good day to you. My name's Christine Mavis. I'm a certified traditional naturopath and I'm also a massage therapist. And right now in 2020 we have an entire spa industry that is shut down. And we have people out there who feel like they need a massage and they just really can't get one right now. So I'm attempting to show people some self-care techniques to help them out at home while they are waiting to get their next massage. And if you are so inclined, you may like my channel by clicking the thumbs up button. This helps YouTube to be alerted to maybe spread my video a little more widely. You may also click the subscribe button, and this is very helpful. It helps to support the channel, and none of this is in any cost or obligation to you, so I would really appreciate that. So today I'm going to show you a few things we can do with a little massage tool called the massage gun. And this is my massage gun. There are different massage guns out there on the market. Some are more expensive than others. This one is less expensive and it has broken down once and I've had to fix it. And I don't use it real often, but I do use it periodically, and it's very helpful to me for self-care. So in one of my previous videos I talked a little bit about a muscle called the levator scapula. It's the muscle that you shrug with. And it connects along the transverse process of the cervical spine, and it also attaches on the superior angle of the scapula, which is the top part of the shoulder blade. So I like to work those areas. These massage guns this massage gun in particular has 4 speeds. And when people are first starting out to use these, they may find the latter speeds, the higher speeds, to be too much. So I usually start people out on speed 1 or speed 2 until they get used to these things. At this point I like to use speed 2 and speed 3. So I'm going to show you how I self-care and self-massage with the massage gun on my levator scapula muscle. So here we go. Transverse process of the spinal column of the cervical vertebrae. And then I get down in there where it's sore on that shoulder blade, upper shoulder blade. Feels wonderful. And I do it on both sides. And I might do 3 or 4 sets of this just to make it feel really good. And it does feel just heavenly. Then another muscle that I really enjoy using this on, because I get pretty sore when I'm doing my massage work. I have to push a lot. And so my pectoral major muscle here, it gets very sore, especially where it connects into my humerus, which is the bone on the upper part of the arm. And so I like to work that with the massage gun as well. And I use speed 2 or 3 for that also. And I use this nice little ball tip. So I will show you how I work that. And that is so helpful. You know, there are quite a few muscles you can work this with, and being able to do some self-massage is great. Sometimes you might have, you know, your husband or boyfriend or another friend around who can help you, and so sometimes working on each side of the vertebral column, those muscles can get sore too. They're called the erectors, and so I like to use this and do one side at a time, or you can take the attachment off, because some of these come with more attachments, and I like to use this attachment for that. And you can just turn it on and just go up and down the erectors, and it will get both sides of the erectors at once when the vertebral column's in the middle, because we don't really want to put this on the bones. We just mostly want it to be on the muscles. So so this is just fantastic to do both of the erectors at the same time. And then there's also this nice flat attachment I've got on this particular gun, and then this if you want to get into some smaller areas. Okay, so with these massage guns, there is a whole lot of different pricing out there, and the less expensive ones like this one, they can tend to break down more easily, and I'm not the only one who has experienced this. I have a couple other friends who are therapists who have also experienced this. And there's a whole range of cost out there. You can just pick out one that suits your needs. This one I like, except that it has broken down once or twice. So, and at any rate, I do want to show you A couple other muscles that I'd really like to work with this. I like to go out and fast walk, and I'm a person that tends to get shin splints. And shin splints are generally they are involved with two different muscles. One muscle is the tibialis anterior, sometimes the tibialis posterior as well, and also the peroneus longus. Now the tibialis anterior, I will show you a picture in a book, but it tends to run on the outer side or the lateral side of the tibialis muscle, bone. So the tibia goes down sort of the front of the leg, and that muscle tends to run on the outside adjacent to that bone. And then next to that, more along the side of the lower leg, is the peroneus longus muscle. And these muscles tend to pull away from the bone, and this causes some of that pain that you feel when you're having this type of thing going on. So I'm going to just show you how I like to work those two muscles, and it does feel really nice. It helps to release tension out of them. So, okay, so you can sort of see the front of my lower leg here, and so what I like to do is just run it up and down here along the leg, right on the side. Here's the tibia bone, and the tibialis anterior runs right adjacent to that. So I'm going to work that, and then I'm going to also work the peroneus bone, which is more along the side here. And this feels wonderful. If you're having some shin splints, oh yeah, this is great. Another good thing to remember with shin splints is that you want to try not to be walking on the concrete or the sidewalks, which is kind of sad. That's what the sidewalks are for, but if you're going out on some fast walking, you want to try and be more on the asphalt or the dirt, because it's a little more forgiving and not quite as hard on these muscles. And now I'm going to work this peroneus muscle that's more on the side. And that tends to be more what I have problems with these days. But this feels just so fantastic to work those. You know, some people like to go around on the back of the leg and work the calf too, and of course that feels really great for some people too if you've been out walking, doing a lot of fast walking. And of course it's nice to do both legs. Yeah, so there we go. So that is it. That is kind of how I like to work those lower leg muscles. Okay, so this is sort of a review here to show you that levator scapula muscle, which was the first one that I used the massage gun on. It's attached to the transverse processes on the cervical vertebrae that you see there, and then also on the superior angle of the scapula, which is sort of the top of the shoulder blade. So that's that muscle. Okay, so now here is the second muscle that I worked. It is the pectoralis major muscle. And you can see that I was just working along the top part of it, and just working the part also that connects into the humerus on the arm. And of course our muscles are layered, so you can't really see the humerus bone because it's got the deltoid muscle kind of covering that up on this photograph. But generally you can just see how I kind of worked kind of on my upper chest on that pectoralis major muscle and over toward the arm. Okay, so now the third group of muscles I was sort of showing you are the tibialis anterior and the peroneus longus muscles. They're on the lower leg in the front, and these muscles are involved in shin splints. And they can get sore when you're doing a lot of walking or running, just to give you an idea of where those are located.